What's up guys, Dr. Mo here. My name is Mohammed Ashori MD. I'm a board certified family medicine physician. Welcome to the Expat Health channel. And today's video might be a little bit longer. It might be a little bit boring, a little bit slower, and there is a reason for it. I think for those of us who are traveling abroad and we find ourselves in these situations where we're in kind of an emergency, we're kind of desperate. It can be difficult to be strong advocates for ourselves, and it can be difficult to negotiate prices. It can be difficult to handle some of these things. So for that reason, I thought I would kind of take you guys through something very important when you find yourself in an emergency health situation. What is an emergency health situation? Let's talk about that. So I can identify about 3 different scenarios where you might be in sort of a health emergency. One, you're a caregiver, so you're taking care of somebody else who suddenly falls ill, passes out, faints, and now you're in that position. And number 2, you yourself are taken to the hospital by emergency, and maybe you're not fully able to communicate and talk and address things as you need to. And number 3, you show up to the emergency department very much panicked, very much afraid due to maybe major bleeding, loss of vision, stroke symptoms, anything that's really an emergency. And the reason I'm using these 3 examples is because I think this is sort of a very worst case scenario, and the majority of the patients I've ever treated in the emergency room that I've sent to the emergency room rarely find themselves in this bad of a situation. So if we can handle these situations, chances are we're going to be able to navigate much milder situations probably just as good. So when it comes to these emergency cases, what they all have in common, they happen quickly. They happen without us knowing exactly why they happened, how they happened, and they don't give us much time to plan ahead and communicate. What they also have in common, in certain markets, in certain situations, in certain countries, certain private hospitals, certain private groups may take advantage of you during these situations. Doesn't always happen, it really doesn't. And we'll talk about how you can prevent that from happening. But when they do, you might suddenly be faced with a $5,000 charge as opposed to a $500 charge, or maybe even much less. So I categorize these taken advantage of situations. I categorize them in 2 ways. One, the clinician, the company, the business, the front desk person is going to take advantage of you by doing something to you or testing you in ways that is not necessary. The second situation is they're going to treat you very well. They're going to do all the things clinically appropriate, but they're going to charge you a lot more to do it. So let's dive in. The first situation, I am the caregiver. Let's say my girlfriend suddenly passes out, faints, maybe is even having a seizure episode. What do I do? What can I do? So immediately I'm going to call, let's say, an emergency phone number. Let's say I'm in Spain, I call an emergency hotline. Let's say I'm in Mexico. Let's wait for this guy to pass. Well, that's actually an emergency helicopter here in Germany. There is a medical hospital right here, and so they fly patients in and out. So this is a great example. In fact, let's use this one. So I have my girlfriend. She has a very serious emergency situation. Maybe I realize that she needs to be, she needs a neurosurgeon immediately. Let's say she's having a brain bleed. Well, I would be calling an emergency line, and they're probably going to send an ambulance, maybe a helicopter ambulance, right? And they need to airlift her to a hospital that can take care of the management. So I'm panicked, I'm freaking out, she's unresponsive, she doesn't know really how to handle this situation, and I gotta step in and I gotta do something. So when I get to the hospital, when I'm flown there, I can immediately ask, I want you to do everything possible for my girlfriend, I want the best care possible, but what is it going to cost? Now, in certain hospital settings, in many more developed countries, you may not have to do that. But some of the developing countries, you're going to have to do that because they're accustomed to negotiating everything. Everything's about money. And you're going to have to stand up and say, what is this going to cost? What are they going to do? Who's going to see her? What are the steps you're going to take? What are you able to do? What are you not able to do? These are difficult questions to ask, I know, but if you can be kind, if you can be nice, even if you're panicked, you can still ask these questions. You certainly don't want to come across as ungrateful or accusatory, and this is something you have to practice. Hi, this is my girlfriend. I'm really afraid right now. I'm really scared. I don't know what to do. Sorry, my English is, I can only speak English. I can't speak Thai, Filipino, Spanish, and I just want to make sure that she's taken it she's taken care of. But at the same time, I'm really worried that this is going to be too expensive and we may not be able to afford it. Can you tell me who's going to see her, what they're going to do, and how much it's going to cost? So the response might be, we don't know until the doctor sees your girlfriend. There's nothing, I cannot give you any prices or anything like that. I totally understand. Thank you for that. But what is the maximum that it's going to cost? I need to have an idea of whether we can afford this or whether we need to take her to a different hospital. Rarely are you going to hear anything beyond that about, well, you can't take her to another hospital. There is no other hospital, because that is not usually the answer that somebody would give you. But they might say, well, look, the most that it's going to cost, it's probably going to be $5,000, let's say. And at that point, you're going to have to think about, where are you? Where are you located? What are the cost of things? If you haven't researched that, I think that's a problem. So a big part of this is to have an understanding of the healthcare environment you're in. If I'm traveling through Spain, if I'm traveling here through Germany, I go to a private setting, it's very normal to pay $5,000 for a severe emergency, something like this, including the emergency airlift, etc. But if I'm in Mexico, if I'm in Thailand, if I'm in the Philippines, $5,000 would be ridiculous. It'd be incredibly unlikely for it to cost that much, even if she's seen by the neurosurgeon, even if she needs an emergency surgery, assuming she doesn't need later, much more complex surgery, even an emergency surgery done by a trauma surgeon or a neurosurgeon where somebody would have to drill a small hole to evacuate some of the blood in there. It shouldn't cost 5,000 US dollars or 5,000 euros. And that's something I need to have an upfront discussion about. No, that is way too expensive. I wouldn't be able to afford that. So do you have any other options? Can somebody see her and then maybe give me a price point? Is it possible to, give me a different price? Because, I understand the healthcare system. I live here, or I've been living here for the past few months. So having a little bit of back and forth, letting that person know that you are aware of the costs, but you want your significant other taken care of. That's all you can do. That is the situation you're in. Now, this is one of the worst case scenarios you can imagine, but let's say your girlfriend potentially had a seizure. By the time you get to the hospital, she's doing much better, but maybe she was taken there by a car ambulance or the helicopter ambulance that you just heard. Well, you can say, pause, stop. Thank you for bringing her here. Thank you for calling the doctor in. I know we're waiting for the doctor. I need to know how much things cost. And if you get a price that seems ridiculous, again, it's important for you to research the costs in your area. And I have many videos on how to research costs in your area ahead of time. What is an emergency cost? How much can you be charged? What is the average charge for emergencies? You can research that. Based on that, you're armed with knowledge and information where you can have this discussion and say, no, absolutely, I'm not paying $1,500 for this. She's doing fine right now. I'm going to go ahead and take her somewhere else. But if you can maybe work with me and tell me how much it's going to cost and give me a better price, give me a more realistic price, I'm happy to work with your doctor. Something along those lines, I think, is respectful. Somebody who is trying to upsell you will understand that you know what you're talking about. So another situation might be where I am not able to speak for myself. I am so disoriented in everything. I go to the emergency room and I call 911. Somebody calls 911 for me. Somebody finds me and when I say 911, I'm talking about the emergency line. So somebody activates the emergency line and they take me to some location. So what now? Well, one of the most important things is, when I first get to a location, is to understand how the healthcare system works, how the emergency system works. If I have no choice whatsoever, then the best thing is to just be taken care of and negotiate the price after the fact, obviously. But once I get to the hospital, if I'm familiar with that hospital, chances are I would be. If I'm living in a particular location, I know that there's only however many number of hospitals. This one's public, this one's private. Obviously, I was taken to the private one. I should have an understanding of how much things cost. So let's say I'm brought in by the ambulance there. I'm coherent, I'm able to have a conversation, well, then I want to be able to have a discussion and say, well, how much is my care going to cost before we start anything? I just need to have an idea. It's going to cost $5,000. No, absolutely not. That is not an appropriate price. Can you please give me a different price? I definitely want to be taken care of. I know you have good doctors, but that is not an appropriate price. And then maybe they might say, okay, well, look, it's probably not going to cost more than $500. We can make sure that it's not going to cost more than $500. If anything is more expensive, we can always come back to you and have a discussion. That's when you know that the front desk person or somebody's really being genuine and honest. They're like, look, we have a system in place for, let's say, as they call it, the gringo price. We have that in place, and this person didn't bite. So let's just be honest, let's be upfront. But if they're not being upfront, if they're treating you like scum, if they're treating you like they don't care about you, you have to leave, you have to get out of there. I had a very sad interaction with a patient who had a hip surgery in another country, which I'm not gonna name, and the entire process of him when he was taken to the emergency room, when they found out that he had a hip fracture and they wanted to do the surgery right there, which they didn't need to, they could have waited. The entire thing was very bad from the get-go. It was a bad experience. Whether he was in a bad mood or not doesn't matter. They didn't treat him right. He didn't feel like he was being treated right, and he still proceeded with the surgery. And unfortunately, he had a very, very bad outcome from that surgery, and it made it that much more difficult and complicated to deal with, and he's still dealing with that to this day. So knowing the hospitals that are in your area, knowing the prices that one should expect to pay, and speaking up, saying something and having that discussion. Researching it ahead of time is one of the most important things that we can do. That's absolute necessity. So once you get to the hospital, there's this other piece, right? Are they going to just be like, oh, you need an MRI and a CT and a blood test, and we're going to do this surgery on you, we're going to do this. They're selling you. They're trying to do a bunch of stuff on you, right? That's just poor clinical care, as opposed to like, we're going to give you good clinical care. Yes, you have this severe abdominal pain. You have a very high fever. It is possible that this is appendicitis. It is possible that it is ruptured gallbladder. We need some further testing. Why don't we proceed by getting a blood test? Let's see where that's at. Why don't we proceed with an ultrasound? I have an ultrasound machine in the back. I can bring that. I can take a look and see what we see. If it's necessary, we may have to get a CT. The CT will be expensive. This is how much it's going to cost. These are our options. If you end up having something abnormal, we're probably going to recommend have the surgeon come see you. This is a very different scenario than you have abdominal pain. Of course, you need a CT. You need a CT. You need ultrasound. You might need an MRI, and we'll decide from there what we're going to do. No, I don't know. I don't know who you have to see. I don't know what you have to do. That's how we do it here, and this is how it's going to be. And if you don't like it, if somebody talks to you in that way, then you know that they're not genuine. They're not being genuine. They're not being, they're not being sensitive to what you're experiencing, what you need. And that is the main difference, is just being able to communicate with a clinician. Sometimes it's just a bad doctor having a bad day. Sometimes it's a good doctor having a bad day. And that's okay, because you can turn that around. You can say, doctor, I know, I'm sorry, maybe we started off on the wrong foot. Listen, I'm just really afraid. I don't know what this is, but I'm also afraid of the cost, and I want to make sure that I'm being taken care of properly. I want to make sure that I'm not getting on any unnecessary tests. You mentioned that it could be this, it could be that. Could we dive into that a little bit deeper? If that wakes up the physician, and now that physician, he or she says, look, I'm sorry, I know you're right. We got off on the right foot. Let me explain what's going on. Let me tell you why this is so important. Let me tell you why we need to do all these things. If the explanation makes sense, and that physician is willing to wield your questions and answer them for you, you're in a good setting, you're in a good place. If that physician doesn't, then you need to leave, you need to exit, you need to go somewhere else. If you can't advocate for yourself at the moment, you need to call someone or have somebody arranged to advocate on your behalf. That is health, that is healthcare. Unfortunately, in any country, it's always going to be the same. But if somebody can explain things to you logically, and they're telling you that these are the steps that we have to take, unfortunately, there's no other way around it, you may have to listen, you may have to oblige, you may have to just go through with it. For example, if somebody's experiencing a stroke, somebody might say, look, we need to get a CT scan. Yes, you have a headache, but it's the worst headache of your life. You got to get a CT, and I'm probably going to get an MRI, and I'm probably going to call down the neurologist. I'm probably going to have the neurosurgeon even come down. So I know it's a lot of things, but here's what it's going to cost. Here's what it's going to look like. This is the worst case scenario. This is what we're going to do. So I threw a lot at you guys, but I hope that this arms you with knowledge, knowing that when an emergency happens, you are in good hands because you can take care of yourself, that you can advocate for yourself, you can speak up, you can ask questions, you can get good answers. Now, I gave you the worst case scenario. Most of us, the emergencies that we're gonna have, I just did a video on this, we're gonna have burns, cuts and bruises, lacerations, and we're gonna have orthopedic stuff. So burns, lacerations, cuts, really bad scrapes, and fractures and sprains. And when those things happen, you can take your time. You know that it's not an emergency. You're not going to die. If you're bleeding arterially from the major arteries, yes, that's obviously an emergency. You're probably calling an ambulance. But if it's something that you can apply pressure on, somebody needs to see you, they can explain things to you in a calm way. We as doctors are trained to stay calm in some of the worst case situations you've ever seen. Good doctors will always communicate with you. Good doctors will always empower you. Good doctors will treat you even when you're at your worst. Now, there's a certain limit. If you take advantage of someone, if you belittle them, if you're disrespectful, up to a certain point, somebody might, I guess at that point, it might just be really difficult. But I can tell you that many of my physician colleagues, we've been in very tough situations, very rude patients, to be honest, and it still turned out quite well. In the end, the patient apologized, and things went really well. I can think of a really good case right now, and it's just sometimes we're just in a bad mood as doctors, and sometimes patients are in a bad mood. What matters is that they can communicate with you and they can talk you off the ledge, right? And they can explain things to you. So when there is a laceration, when there is a trauma, when you go in, the first question always is, how much is this going to cost? What are they going to do? Who's going to see me? What are the next steps? Now, of course, if it's the front desk person that's answering those questions, you're not going to get a good answer. But a really good front desk person, and most good hospitals are going to have a really good front desk person. That's just the way it is. Good people work in good places. The front desk person say, listen, I don't have the answers to that. Let me bring the doctor. Let me have them talk to you. I will tell them that these are the points you want to address. Or the doctor is really busy, he's dealing with a bunch of emergencies, but we have a really good nurse. She can probably talk you through this. The nurse who works in the emergency room knows what the doctor is going to do in many of these emergency cases. It's rare to see an emergency that's never happened, not for the healthcare staff, not for the clinicians. So the nurse can come in and say, look, this is complicated because you have this laceration here. It is involving one of these arteries. Probably we don't know. We probably have to do some tests. It might need a CT, it might need an MRI. We may have to send you to a different facility. We're probably going to call in a vascular surgeon from another location. That's going to be extra fees. But these are the things that we need to make sure it's not, because it's going to need to be repaired. These are the things that doctors are going to want to do. How do you feel about that? Do you have any questions about it? Is that something you can afford? If not, maybe I can talk to the doctor. We can try to come up with some other options. That's what I do even in the United States with my patients. So I hope this is helpful. Signing out, Dr. Mo, Expat Health. Share your stories below. Educate others, let's empower each other. When we are facing these situations, the best thing that we can do is stay calm, ask questions, and tell the person that we do care about the price. It is important to us. Take care, guys.